Good afternoon, everyone. Welcome to our webinar on suicidality and COVID-19. If you could please make sure you mute your phone so we can minimize the background noise.
I think other people have like background noises.
Yes. Okay, I'm gonna mute everyone just to minimize the noise. Okay. Okay, so before we get started, just a little disclaimer I would like to go over. The views expressed in this training are those of the trainers and are based upon their extensive experience and expertise. This presentation is not meant to diagnose people or provide any clinical advice. I also want to make note this presentation may cause emotional distress, so at any time, please feel free to log off or step away and to talk to someone you trust if you need to process the discussion. So today we're going to start with an opening prayer. After Dr. Segay does the prayer, we will do some housekeeping, followed by an introduction, and then we'll lead into the actual presentation. At the end will be Q&A, and then we will close out. So Dr. Segay, would you like to do the prayer?
Yes, thank you, Courtney. Good afternoon, Yate. My greetings to everybody from Navajo land. My name is Dr. Glorinda Segay, and my clans are Tendri Kinenshno and Twadichini Bashishchin, Anagani Dashanella Topahantashache. So at this time, I would like to go ahead and ask you to bow your heads and join me in prayer. Koto Hajondo le Shamana Hassa Yadeshkishitka, the Indene Ano Lini. Edi na awe ni ajanashno e nana teacher ni chotodesi ni hikidin ito ha haliado di kwa e ina iki e bayat keto e ina che na e hashit a e hatseke sigi e bent I do e benna e china e dest jinzenle e what a ni hidden apit na hina e di kwa Baya dotke hashet baka adowal ado hashet sekes at nantinet do naha benach di nihizito nihi nantkin dole di nihidene baka dicha hota nakaliado ado njana go di baya dotke ado nana nekilhon lodo di ko na nihiki at nihi Nehent nekidntito haliado I kwa na hinhalchnedo hichonedo havan ate benashni wotan to desil be hajona hasli amen. Courtney.
So now we will move into introductions. As Dr. Segay said, my name is Courtney Wheeler. I have been at National Indian Health Board for about 2.5 years. I work with Dr. Segay on our behavioral health work, as well as emergency preparedness and tobacco cessation. Dr. Segay, would you please introduce yourself?
Yes, thank you, Courtney. I'm Dr. Segay. I was the previous behavioral health director, and so now I'm the public health coordinator. And so I've been at NIHB for a couple of months now, and basically my role is within the behavioral health capacity in regards to assisting Indian country and also there at the national and federal level. And so my experience with Indian country is I was born and raised on the Navajo reservation. And so I'm happy to say that I'm a res girl and a product of the res. And so I bring my tribal lens from the reservation there at a national level, to help to collaborate and bring some understanding to the leaders there and the federal entities that we work with. So that's my responsibility. Thank you.
Thank you, Dr. Segay. So there's a few more things to go over before Dr. Segay begins her presentation. Located at the bottom of your screen is the chat box. We ask that you put any questions or comments that you would like to make into the chat box, and we will be monitoring that throughout the presentation. So this presentation is being recorded, and we will follow the agenda as closely as possible. After the presentation is over, the PowerPoint as well as the recording will be available on our website. Please give us a few days to make the presentation recording available. We ask that, if you do have questions, please put them in the chat box. And if there's information or things you want to share with everyone, please put that in the chat box and we will get to those throughout the presentation. At the end of the webinar, you will receive an email link to complete an evaluation. We ask that you please complete those. We use those to make sure we are providing information that is needed and that is being asked for. And it is also recommended that you smudge yourself after the presentation. The learning objectives for today's presentation training. Afterwards, you will be able to describe elements leading to suicide seen in American Indian and Alaska Native communities, comprehend the DSM-5 diagnostic criteria for major depressive episode, including suicide, identify the symptomologies of suicide, how to help a suicidal person, as well as comprehend management and treatment for suicide. The National Indian Health Board was founded in 1972 by the tribes, and we work on behalf of all federally recognized tribes. So a little bit of background about NIHB. We are broken up into 3 departments. There's the Policy Center, which does research and analyze policies and consultation and provide technical assistance to tribal advisory committees. We have our Congressional Relations Department, which monitors and educates Congress and staff on Indian country. And then we have the Public Health Policy and Programs Department, which is the department that Dr. Segay and I both work in. So we do programming, we do technical assistance as well as in addition to public health research and a variety of other things. So Dr. Segay, would you like to begin?
Yes, thank you for Courtney. So I just want to apologize ahead of time that a lot of us are learning how to use the technology virtually due to the circumstances across the world. So we apologize for any technical difficulties. We're just going to continue to follow along, so it'll help. That's why we have the slides there, to help you in case that should happen if I'm cut out. So here are some suicide statistics. There's a lot of statistics out there, but these are the statistics that I gathered that really popped out to me and was relevant to Indian country. And so here, suicide among Indian country is basically throughout the US, the attempts and those that end their life by suicide is more prevalent compared to other racial or ethnic groups. And also our youth, American Indian youth, show higher rates of suicide compared to American youth of other racial and ethnic groups. And then going further, men are most likely to die by suicide than the women. And here, women show a higher prevalence of suicidal behaviors. And lastly, interpersonal relationships, community environment, as well as spirituality, mental health care, alcohol abuse, interventions are among subjects of studies about the effectiveness of suicide prevention efforts. So in other words, whatever elements, whatever resources are on the reservation or off the reservation basically matters in how treatment is going to be determined. Next slide. So what is suicide? So we all have our own definition. We have our own thoughts about what suicide is. Some of us might have experienced it in close proximity with family, friends, even ourselves, so we all have our own different thoughts. So this is basically generalized of what suicide is. Next slide. So here, suicide basically is defined as the act of killing oneself purposefully. So in other words, you have the intent, to die, to pass away. The DSM, I went to that also, and I looked it up. And so at this time, there's no definition or there's no category of itself, there in the manual. So, however, it is found categorized as a symptom for major depressive episode. Next slide. So here, MDE basically has a clinical criteria. And so the criteria in order to fall into this category or to receive a diagnosis of MDE is feeling fatigued or loss of energy just practically every day, almost every day, physically, mentally, your motivation declines, your determination. And so that falls into that section. So you start to develop feelings of worthlessness or excessive or inappropriate guilt. So it's just basically, everything you do, man, I can't do this and I'm frustrated and something's always happening. If it's not one thing, it's another. So that type of thought process and emotions, and your diminished ability to think or concentrate or indecisiveness practically every day. And so, normally, we have levels of focus when we think, when we're able to concentrate, whether it's on a task at home or project, or if we're at work, or even to focus on watching a movie or to read a book, we have different levels of focus. So that's where, you can't concentrate on what you're doing. You can't concentrate on the movie. You're not following the movie. You're not following a discussion. And then you start to become, indecisive, should I do this? Should I do that? It just really happens just at a spur of a moment. I don't feel like doing that. And you get dressed, 1 minute, then the next minute, I don't want to do it. You lay back down. So that's another symptom for that. Next slide. So here is a symptom with suicide as part of MDE. So this is where you have the recurrent thoughts of death, recurrent suicidal ideation with specific plans, or a suicide attempt or a specific plan. And so I was also going further into researching, what about the criteria, or what about the category of suicide when it's the first time? So here it says recurrent. And so there's also the first time, the first attempt, so there I'm still continuing my research. So I just want to distinguish that at this point. Next slide. So here are the symptomologies of suicide in itself. So again, the DSM doesn't have a separate category. So here are the symptomologies of suicide. And this is based on all of my study, my research, and also a pilot testing that I conducted. And so this is where that came out of. Next slide. So here it begins with a thought. So, suicide doesn't happen overnight. It progresses over, a long-term time frame. So there's really no set time frame. We can't say 6 months, we can't say a year. And again, because we have developed differently, we have different cognitive processes. And so here, all in all, it starts with the ideation. They call it ideation as a clinical term. So really, it just means thoughts. You start to have self-thoughts, and some of these self-thoughts can be, I don't want to feel this pain. And so a lot of times they say that, when you're in pain emotionally, mentally, that's when these thoughts begin to surface. And so I want this pain to end. How can I end this pain? I wonder what it would be like if I were dead. I should kill myself, and so on and so forth. And so these are just some of the most common statements that I heard when I was practicing as a provider. And so the next phase, the next step, if you want to call that, or the next level, is suicidal verbalization, the ideation with a specific plan. So now, not only are you thinking about it, which was, step A, level 1, whatever you want to call it, now you're verbalizing it. So verbalizing it out loud. So that's where, you're able to say, I don't want to live anymore. So that's an indirect way. I've treated a lot of patients where they couldn't say it directly. So one of the most common ways it came out was, I don't want to live anymore. A direct way was, I want to die. Some of them were very blunt, and that's what their statement became. And then furthermore, that's when they go into a plan. So some of their plan is very specific. For example, we have a sheep camp. It's secluded. Nobody lives around. I was thinking of going over there. We have an old shade house. It sits pretty high. I was thinking of getting a rope, and that's my method. That's what I want to do, is I want to hang myself. So some of it, could be very detailed like that, and some of it could be more detailed. It gets extreme, sometimes. And so, but that's just an example that I wanted to use. Next slide. So here is the third, the final, the last phase, if that's what you want to call it. So now the person has the ideation, the thought is there, and then they verbalized it, they made mention of it, they also made mention of the plan. Now it's like they're walking in automatic mode. So what I mean by that is that a person just needs a trigger to carry out death. So that can be confusing there. So I just want to clarify that, again, this person already had that self-thought, of wanting to die. They've already spoke it, and they even have a plan. So again, you have to have all three of those, and that's where they're already just walking. They're walking with it. It's kind of like a walking time bomb. And so a trigger could be anything. A trigger could be, say, for example, you wake up late and you're trying to rush around, get to work. On your way to work, you blow a tire, and then, you get to work, and then you're in a rush again. You go get lunch, and then McDonald's, they screw up your order. And then you're late back to work because you're trying to fix your order at McDonald's. And then you get back, to your work, and then your boss brings you in. Then your boss will talk to you about your performance and, possibility of getting fired. So that's a trigger right there. So it could lead up in that sense as an example. Next slide. So here I want to specify on suicide and COVID. And so we've had several meetings, and, we talked about how suicide, is an Indian country now, with COVID. And so I want to focus on that here. Next slide. So I've developed a scenario here. And so I've made some background history of Jane Doe. And so this is how, suicide might play out, during COVID. So this is a scenario. There's all different kinds of scenarios, case studies, whatever you want to call it. So here, Jane Doe, she grew up with a 2-parent home, 7 siblings. They lived on the reservation, so in a secluded area in the desert. They lived in a rundown house studio style home, no electricity, no running water. Jane's parents did not finish high school. Jane's father has a history of alcoholism, but stopped when Jane was born. Jane is the second oldest child. She finished high school, went on to college. In grade school, she was bullied by others. She obtained her undergraduate and graduate degrees. She began working. And then she went through a divorce, and now she's a single parent. So she has 5 children from her marriage. She also has custody of her children, and also has a history of intimate partner violence, suffers from low self-esteem, also exposed, with other types of trauma from her marriage. And therefore, she developed trust issues. Next slide. So Jane does not have family support from her siblings. She lives in a hogan. So that's just a small octagon looking house. She does have history of suicide ideation due to being depressed from her divorce. She never received personal help except through her friends. So now, since the COVID outbreak, Jane tested positive for coronavirus. So she lets her family know, and the family, they end up blaming her for contracting the virus. And furthermore, they blamed her for spreading the virus to her community and even to her mom. So Jane, at this point, she's unsure of her plan. and also her recovery as far as isolation. She lost her job. She has no income except she applied for food stamps, known as SNAP and Medicaid. Her unemployment is pending at this point. She fell behind on her bills, so her self-worth drops. She feels worthless. And she also recently was contacted by her ex-husband, who now wants his family back. Jane has an emotional relapse. She finds out her ex-husband is expecting a baby, and this becomes her trigger. Next slide. So at this point, after hearing about the baby, she becomes furious, and then she becomes suicidal. She doesn't have a plan yet at this time, but she did verbalize to two of her close friends, that she's been having feelings of suicide. So her friends, they encourage her to get professional help, and she denies it because of being labeled. So she becomes stable after several days. Then the ex-husband showed up uninvited. So she falls back into depression, and this is when she decides she will shoot herself with a gun. She's able to obtain a gun. She acknowledges she needs help, but continues with her plan. When she gets to her location to carry out her plan, she breaks down hysterically. She points the gun to her head, then she puts it down, still crying. She calls her friend. The friend's able to talk her out of her plan and able to agree to get help. Then the friend calls the crisis response team. The team, they find Jane, they take her to the ED, they stabilize her, and this is where her integrated behavioral health care begins. So this is a lot of information. I apologize, but I wanted to paint a picture of, looking at Indian country, our natives, our American Indian, Alaska natives, on an individual basis, they all have some sort of story, I want to use that word, about how they came to be. They have traumas, they have successes, so we all have that. And so, that's what it's like, in reality. So I wanted to paint a picture and provide that much information, to get you thinking, to get you, oh, okay, I see, I'm understanding. And so that's the scenario I wanted to use. And so next slide. So here, discussion.
I couldn't quite hear you. Could you please repeat what you said?
So the discussion here is based on what's being presented here with Jane, is Jane exhibiting suicide? And if so, in what ways, So, it is obvious, but I wanted to discuss it and, take this time to say, okay, how do we know? And, what elements, because again, some of us never had to deal with suicide at all, or some of us have the experience of dealing with suicide. So I just wanted to cover our bases. Next slide. So here, looking at the MDE criteria, so the symptoms that Jane demonstrated is feelings of worthlessness or excessive or inappropriate guilt. So there in the scenario, it did indicate that she's feeling worthless, she's feeling bad, and then at the same time she has recurrent thoughts of death. And so, she gets suicidal after finding out her ex-husband is expecting a baby. And then later on, she gets suicidal again when her ex-husband shows up. And then also in her history, she does have the risk factors there. So she meets the MDE, as far as suicide goes. Next slide. So what does this mean? And feel free there at the chat box, as Courtney had alluded to earlier, to engage in our discussion using chat box. So go ahead and enter, your thoughts, comments, and we appreciate that. So in the meantime, let me go ahead and go into this next slide of, so what does this mean? Next slide. So questions, somebody might ask, or, a person might ask themselves, is something wrong with me? Looking, thinking, and reflecting back about, what's happening mentally, psychologically, is something wrong with me? Is this normal? Do other people think this way? How long will I feel this way? How do I cope with this? What do I do? Where do I get help? What will people think of me? Will people blame me for what I was going to do? What is the treatment for what I have? And so, and further, there's going to be more questions, but these might be some questions that somebody will ask when they're in this predicament. Next question. I'm sorry, slide. So here, coping with adversities to prevent suicide. Next slide. So here are some possible coping skills. So we're talking about suicide, we're talking about COVID-19, and so, it's really good to educate yourself on COVID-19 and how to care for yourself when exposed. Just like Jane, she didn't have a plan for recovery or isolation, and so educating yourself using the CDC website, or maybe there's fact sheets that are provided at a tribal level, a federal, national level, Indian Health Service, just learning about it. What are the symptoms? What are the recommendations? How do I isolate myself? Things like that. Educating yourself on suicide, what are the signs of suicide? How do we cope with suicide? Where do I get help? Things like that, educating yourself. Also taking care of your bodies, very, very important, very vital. Ways you can take care of yourself is taking deep breaths, stretching, eating healthy, well-balanced meals. Sometimes when we become depressed or sad, or even when we're physically sick, like when you get COVID, you don't feel like eating. You don't want to eat, or maybe you have a craving just for something, particular food. It could be unhealthy. So that's where you stay conscious and stay cognizant of making sure you eat a healthy, well-balanced meal, even though you don't feel like eating. Exercising daily on a regular basis, just this doesn't mean you go and be a beast at the gym. We're not talking about that. We're talking about maybe taking a walk, to the end of your driveway, or getting the grandkids and come on, let's go take a walk, or, walking with, your pet, your dog, cat. I've seen cats on leashes in Washington, D.C., those are the types of, ways to exercise. Stretching, while you're watching TV, or doing chair exercise, while you're sitting there in the kitchen. So those are examples. Getting plenty of rest at night, including naps, that's very important. Again, recommended hours, 8 hours. And avoiding alcohol and drug use, so that's a really big one. When alcohol, any substance, they're partners, when it comes to depression and suicide, so that seems to make things worse, and so it's really important, again, to avoid substances. Make time to relax with activities you enjoy, maybe laying down at the end of the day on the couch to watch TV, or maybe just sitting on your swing on your porch, taking a walk, whatever it is. Connect and stay in touch with your circle of friends and family, and talk with those you trust. So again, we got to keep all the CDC guidelines there in mind. And so again, we got to practice physical distancing. So that means, calling your family members, your friends over the phone, or maybe video calling, or visiting through the window, things like that, talking through the window with the barrier. And also practicing your cultural and spiritual practices. Some tribes, there is their religious significance about suicide, and so that's where, we're acknowledging it, or we're getting some help from the elders, to understand, to bring back balance, in your element. And so there, we encourage that. And also seeking behavioral or mental health professional who can help you, who can guide you, and, who can help you to process. And so again, with the COVID, it makes it, difficult for us to just walk into an outpatient clinic, and so again, please do know that they do have hotlines, out there where you can call in, and so that's available again as well. And maybe in your communities, they have that resource too, so you just have to research. Next slide. So here, if you could type in the chat box there, what are ways in your community or maybe in your own personal experience, that prevents suicide, what's going on there. So if you could share that, that would be great. So go ahead and take this time to do that. As you're doing that, I'll move to the next slide. So here are some activities to help others to prevent suicidal thoughts. And so again, suicide is very, very difficult to talk about. It's very hard, to look at the process and understand our process. And so, here we want to prevent suicide overall. That's what we want in Indian country, because Native lives, it matters, everybody's life matters in the sense of, when it comes to suicide. And so it's really hard to explain. Sometimes it's complicated to explain it. But here, remember we talked about the symptomologies, the phases, so it broke down the thought process from the self-thought. And then it went into verbalization with a plan, and then it went into automatic mode. Remember that? And so here, before it becomes, a thought, that's where it starts. So this is where, these activities are recommended to be used is, right before it becomes a thought, or maybe you're informed, So again, exercising daily is recommended. Getting the 8-hour recommended, hours of sleep and nap if necessary. Doing an activity here, you can do your crafts, your beadwork, your featherwork, knitting, journaling your emotions, spending time with pets or animals. If you have horses or cattle, maybe you have a dog, a cat, a ferret, meditation too. Listen and play positive music. I want to emphasize on that. A lot of times music, helps us to express our emotions, our feelings. And so I emphasize positive music because, being aware that out there's music that encourages suicide, we want to stay away from that. And so sometimes the lyrics will allude to that, making it okay. And it's not okay. So I just wanted to denounce that part and say, listening to positive music. And it doesn't have to be music like, rap or, country. It could be our American Indian music like, peyote songs, powwow songs, maybe some traditional ceremonial songs, that we use in our ceremonies, a horse song, things like that. That's really good. Again, spending time with family and friends. With physical distancing, again, I just want to emphasize, we are in a pandemic, so we need to resort to phone now, video calls, talking through the window. Breathing exercises, that's where when you start to feel angry or getting emotion, that's where you just kind of stop and breathe. Self-prayer, at this time, it's hard to go out to get any kind of cultural, help with our elders. It's hard at this time because of physical distancing, so that's where, we're taught as natives that we have a prayer, that we know how to build a fire. We know how to roll a tobacco. We know how to, get our peace pipe ready, our pipe, and we know how to pray. We've seen it so many times. It was emulated by our elders, our parents. As we grew up as children, they exposed us to that, even though we didn't know what's going on, but it's been done redundantly so many times that it's almost automatic for us, that we know how to do these things. Not just traditional way, but, even through, the church way. At church, they teach you the Lord's Prayer, they teach you to pray with the rosary, they teach you how to use a certain prayer, so it's good like that. I just want to say a whole, for that teaching, very important. And also self-smudging, how do we smudge sage and cedar? Do we do it at the fire? How can we do it in the home? Like my mom, she has a small little frying pan. We call it a frying pan. She puts it on the stove and, she'll turn it on and heat it up. and she'll put some cedar in, and then that's where, you know, that the smoke is created, and then that's where she smudges herself. She brushes the smoke onto her body to remove that negative energy that she's feeling. So that's one way. And also self-tobacco offering. Again, I talked about that, you know, just 2 bullet points ago, you know, just rolling your tobacco, you know, using your mountain smoke, you know. So there's a lot of different variety of smoke that we use depending on the offering. So, you know, keep in mind that's there too. You can always provide your offering to the holy people, to our deities, you know, and talk about this and pray about how you're feeling, talk about it, you know, make it known to them, you know. And so we always had that belief that our holy people, you know, they're very holy, that they can, you know, bring us out of these types of emotions. And so again, these are some possible activities. Again, you're not limited to this, and there's a lot more. So I just want to highlight some of those areas. Next slide. So recommended ways to assist a suicidal person. So I want to go to the chat box here. So another way, Justin says sweat lodge, Elizabeth, you know, gardening, feel the earth, you know, when we're growing our food. Again, assist. So there's programs out there that are developed, curriculums, you know, like the assist training, QPR training, you know, focused at youth and adults, cultural events and positive family events, you know. So again, you know, we got to keep in mind we're in a pandemic too, you know. When we were at our old normal, you know, these were things that work. So as we move forward, you know, we have to become more creative. So thank you, Rosanna. Meditation. So she talked about Michael Yellowbird's work on meditation and mindfulness for natives. So that's available. Some traditional healers are helping folks by phone during the pandemic, and that's good to know. And so calling your healers, you know, to help you at that time. Family support paramount. Also, Tyree, finding value in life becomes key, showing a person with thoughts of suicide, their value to family and community, repetition works, listening and creating a relationship, which in turn can be valued. So thank you for that. Sharing the secret with someone you trust seems to help. So Cindy, you know, makes mention of that. And so thank you for the group chat there. So going back to our slide, recommended ways to assist a suicidal person. Next slide. Is everyone okay? Just want to check in with everyone at this time. If you could use your chat box, let me know if you're okay. If you need to step away, you know, it's okay to step away and then come back. If you need to log off, you know, it's okay to log off. You know, this is really heavy, so it's okay. It's all right. So here are recommended ways. Thank you for letting me know that everyone is okay. I appreciate it. Thank you. So when a person approaches you and indicates, you know, he or she is suicidal, stop what you're doing and listen. Remember how we talked about the second phase. So when a person verbalizes it, you know, most likely they're in the second phase of the symptomologies that we referred to earlier. So, you know, it's really important when you listen to someone, you have to listen with your heart, you know, and give your full attention, because the person will know. They will know if you're paying attention. They will know. And so some of us, we have selective hearing, you know, we only want to hear what we want to hear. And some of us, we just kind of, you know, we're not paying attention, but we're like, you know. And so again, it's very important, you know, that we listen with our heart. So once the person is done, you know, it's always good to thank the person, you know, thank you for thinking of me and coming to me, you know, with what you had disclosed, you know, thank you for trusting me like that. Thank you for that. So you're acknowledging that. And at the same time, you're empowering the person. So keep in mind that the person feels powerless, you know, they feel worthless. And so that's a good way, you know, you thank the person. And then you tell the person that you're concerned about them, and that you would like to get them some help, if it's okay, so there's a certain way to the delivery style. So, all my times as a provider, I always told them that, is it okay if we get some help? And most of the time they agree. For I would say 99% of the time they agreed, that okay. And so if they don't agree, you just always come back and, offer some help. So stay with the person. So make sure the person is basically there, or sometimes they'll call you over the phone, keep the person on the phone, and then start to arrange for help. So you want to keep them there with you, and so since this pandemic is happening, it's going to make it a little bit more challenging, to keep them there in person. Again, just keeping in mind the physical distancing. It's going to be hard because, you want to hug the person, you want to show some sort of physical affection. And so, but the pandemic makes it complicated. So you're going to have to get creative. And then once you prompt help, most likely responders will take the case over, and it is recommended to keep, information confidential, even though we're not providers, or even though, we don't have an ethic to go by, but in Indian country, it's just always respectable, because this information, the person had to come to a certain point in their mind. It takes a lot of courage for them to want help. So there's that window of opportunity. It's a real small window. Once that window closes, and boom, it might never open again. So we got to keep in mind that there's that small window that they open for us, where they, have that will to live, and, they want some help, so they come to you. And so out of respect for that, don't go out into the community, or don't tell people, hey, so-and-so was suicidal, they call me, and, these are the elements, X, Y, and Z, So again, when you do that, it could be damaging. I've seen it. I've seen the aftermath, to where, so-and-so shared about another person, and it made this other person hesitant to go for aftercare, and said, I don't want to go. People are talking about me. It becomes gossip, so that's where, I ask, let's be respectful when someone comes to you, and when you help them in this sense, keep it confidential, keep it to yourself. And so when you're done helping a person, smudge yourself, because sometimes, as natives, we believe in energy, and this energy can latch onto you, and it can make you feel, that power. So that's where you want to smudge yourself. And after you help the person, whether it's through offering, tobacco offering, or you just want to smudge, and so it's good like that. Next slide. So here are some more facts about suicide I just wanted to cover. Next slide. So again, with the DSM, you always have to meet a certain number of criteria, the clinical symptoms, in a certain time frame in order to be treated or diagnosed, in that category. So again, with suicide, if treatment is not sought, it can get worse. So be mindful of that. And here, CBT therapy, this is a type of method that's used, cognitive behavior therapy and medication management, that can also help. Please get professional help if you are concerned about the possibility of becoming suicidal. So say, you're in the first phase to where you have self-thoughts of it. That would be a good time to prompt help, calling a hotline, or maybe calling the person you trust, or calling your mental health provider. Here again, I just want to emphasize, I think this is really important, so I bullet pointed again, that interpersonal relationships, community, environment, spirituality, mental health care, and alcohol abuse interventions are among subjects of studies about effectiveness of suicide prevention efforts. So we all have different resources in our communities. Some of our resources are very limited. Some of us have rich resources, and so again, all that will determine the outcome of, how this is taking care of the type of treatment, or even the prevention. So again, suicide is the second leading cause of death among American Indians and Alaska Natives. So we're looking at ages 15 to 24. And then the third among ages 5 to 14 and 25 to 44. And so that's pretty alarming, and that should tell us something. That should send a message to us, as providers, as leaders, concerned citizens, and so that should say, hey, we need to do something. American Indian, Alaska Natives who have lived 2/3 of their lives in an urban area have lower suicidal ideation than those who live 2/3 of their lives on a reservation. And so, it's interesting, we could have a whole day discussion on that, but it's interesting to see like, okay, urban versus reservation. Urban youth suicide is linked to history of physical abuse, attempt or suicide, death by a friend, and family history of suicide. Reservation youth suicide is linked to depression, conduct disorder, cigarette smoking, family history of substance abuse, and perceived discrimination. So I thought that, those facts were interesting and I wanted to share with you all. Next slide. So again, group discussion, please use your chat box there. Question to all of you is, why is it important to know about suicide? Why is it important? It's important because I've seen it so many times. A person has never dealt with suicide, meaning when somebody comes to them and discloses, their mind goes blank. What am I supposed to do? And so, that's why I wanted to share, some recommended ways of helping someone. And so I do know in communities, like on Navajo Nation, they did the Community of Hopes, and Dr. Brown from Shiprock, she's a clinical lead there. She's on our webinar now. She led the Navajo Nation in regards to providing, generalized information to the community through school presentations. They went to all these chapter houses to different regions on the Navajo Nation and provided, real basic knowledge. And this is what you do when someone is suicidal. This is how you help them. And so they did that effort. So that was a community effort. And so, in hopes that, other communities are also, leading their efforts that are effective for their community. And so, again, this is one reason of why it's important to know about suicide. And so some of the chat responses is, you can be the beacon of light and hope within your family and community circle. It's important to be prepared. That's a really good point. I work at a university and want to know how to help students who are in need of assistance, and that's a good question, so we're always wanting to help one another to develop efforts. We recognize these signs and get them the help they need before they follow through with their plan. Exactly. Everyone matters. We need skills to help our people. Save lives. Yes, that's important. It's important because we don't know what people are going through, and we can save their life by listening or helping them. Very, very good comments and responses. Thank you. One time I was sitting in a presentation. I'm going to go on a tangent here. And, it was described to me that, being able to have knowledge about suicide, like assist or QPR, is like CPR. So CPR is more developed for the physiology when you save a life. When someone stops breathing, these are the steps to take. So on the other sense, in the same sense, here is some basic information through assist or QPR or mental health first aid, or whatever curriculum is developed, this is how to help, a person, but it's more of on a mental aspect. So just wanted to share that. Next slide. So here we'll go ahead and give the time. As far as questions and comments, please use the chat box. And I just want to be mindful of the time. So it is now 3:53. And so please use your chat box. So Rosanna Jackson, some people have expressed to me they never knew about all the signs. After being educated about recognizing other signs, such as mental, physical, verbal signs, they still don't know the resources or what to do after someone says they have suicide ideation. Thank you for that. So here, is it possible to get references so we can learn more, like where you got the stats? Yes, you can go ahead and email myself or Courtney, and we can get you in touch with that. Thank you for this training and information. John, thank you for that. And so, next slide, Courtney. So here, some take-home messages from this webinar. Again, it's part of public health education, is to help you to understand the basic knowledge of how suicide comes to be. So we talked about the criteria and the DSM. First, we started with the basic, definition. Then we went into the criteria with MDE. And then we talked about the symptomologies there. And then we looked at Jane Doe, so we put it together there to understand a little bit more. And so again, we want to help you to understand the basic knowledge of how suicide comes to be. And then now that you know that, how are you going to help to advocate for those who suffer from suicide? So we probably have some tribal leaders. We probably have some policy writers, on the webinar. We have some providers, So how are you going to use this knowledge, and plus your experience, to advocate for those, and to explain and to say, hey, this criteria needs to be developed. This is how much money we need. We want to do this effort, so things like that. And then in general, how to recognize suicide. How do you recognize suicide? And then how to help a suicidal person. And so those are, that was our intention and our hope that you could take this home, to think about, to marinate it a little bit more. Next slide. So in closing, again, thank you very much for taking the time to register into our webinars. We do have some webinar series. So we have another one coming up on intimate partner violence, and just go back to our website, that information is there. And so I just want to also say thank you for the work that you all do, with suicide. It's really heavy. It can be a burnout, it can be a burden, but, I just encourage you, to continue to help our Indian country, so that we can beat this monster, in our country. It's probably referred to as a pandemic, in Indian country. It's happening to our people. And so I just want to make those remarks again. Thank you for joining us. Next slide. So here are some resources. Our website, you can look at the COVID information there. You can just click on the hyperlink. And people who are at high risk for severe illnesses, because of COVID, SAMHSA, they have resources coping with stress and infectious disease outbreak. Again, taking care of yourself during infectious disease. Next slide. We have some more responses in the chat box. So how do we break through stigma or community holes around the topic of suicide? Daniel, thank you for the question. So that's where on Navajo Nation, as far as I know, the way that they made it comfortable for our people to come out was an executive order was issued at an executive level through the president and the vice president. So they acknowledged suicide, and that's where they got together with the behavioral health experts and programs, Department of Health, and that's where they started an effort, and that's where that Communities of Hope came to be. And the Communities of Hope went out to all the different schools across the reservation, off reservation, even to some universities and colleges. And then it went into the chapter houses. It started becoming, it started to become normal, with Navajo, that it was a curriculum that was provided. And so that's one way, that the effort can be made. And Kim Williams, thank you for your comment. Wash your hands, everybody. thank you for your words today. And Rosanna indicated that, you know, something else I find important to say while educating is let them know about the suicide hotline number. So that's available. There's a request for Navajo Nation. Do they have a hotline? So go ahead and email all the information to me or questions, and I'll be happy to get you in touch. So back to the slides here, references that were used in development of this presentation. Again, it's all listed there. Next slide. Christopher Yate, thank you for joining us. And again, final questions and comments. And so I've read some comments there. Next question. Sorry, next slide. I keep saying that. So here, please complete your evaluations. Courtney will send you a link, and this is where you complete and submit. So I promise you, it's really easy. You don't need to enter really extensive information, and then you just press submit. Next slide. So yeah, thank you very much for joining our webinar. God bless you. Take care of yourself. You know, wash your hands, social distancing. You know, thank you for everything you do, and God bless you. And so that ends our webinar today. Yeah, you may log off.